Good evening, and welcome again to Public Perspective. I'm your host, Kevin McDermott. And most of us eat breakfast, eat lunch, eat dinner, and don't think much about the fact that food is plentiful and we can eat whatever we want, whenever we want. But that's not true for everyone in our society. And so here tonight to talk about those who need extra help with nutrition and understanding, Margaret Saunders. Margaret, the director of the WIC program at CEDA. Now we'll talk about what all that means. We'll put that into regular terms that laymen will understand.
Unpack all that, right?
Unpack it, yes.
Well, CEDA is a community action agency.
And it stands for
the Community and Economic Development Association of Cook County. And it's a community action agency, meaning it's a grassroots organization and provides services in the communities of suburban Cook.
So it's a
and
private
the city
entity.
of Chicago.
It's not part of the government.
We're a nonprofit, 501c3 designee, and so we provide a variety of services through a variety of funding streams to help the families within our communities.
And so then WIC, the Women, Infants, and Children program, what is that?
Yes, the official title for the program is the Special Supplemental Nutrition Program for Women, Infants, and Children. And it's an intervention and prevention program based in the community, and actually the only public health nutrition program at the community level that is specifically for pregnant women, breastfeeding and postpartum women, infants, and children up to age 5. And the design of the program is to help make sure that during these very critical times of growth and development that we're just providing as much stability as we can to these young families, and so we can help make sure that we're having as positive a birth outcome as we can, and that the families are learning and growing and becoming capable and competent parents, so that the infants are well fed, and then of course our ultimate goal is to make sure that the children are as school ready as possible when they turn 5.
And so this is a national program, right?
WIC. It is. Yes.
Coming out of Washington.
Yes.
Right.
The federal agency that oversees WIC is the United States Department of Agriculture. And so they really oversee all of the nutrition programs in our nation. So WIC is a nationwide program. We are guided with federal regulations. So the WIC program should look the same, have the same quality of service regardless of what state, as families move around and, can transfer from state to state. But the effectiveness of WIC is it is a community-based program. It should be based in the neighborhood, open and accessible and friendly and welcoming to all young families or anyone who's a caretaker of an infant or a child under age 5 that is self-identifying as having some food insecurity.
So then it's just to get the relationship correct. So the federal government is the creator of the program, the funder of the program, but then it's delivered at the local level, right?
Yes.
And so CEDA is the organization that gets the money from the federal government, follows the federal government guidelines, and then delivers the actual services to the community. Do I have that correct?
Yes, there is another important partner in this. The monies come through to Illinois from the federal government, and the Illinois Department of Human Services is actually the local agency that or the state level that oversees all of the WIC services in the state of Illinois.
Okay.
CEDA just happens to be the largest WIC program in Illinois. We have an active caseload of about 50,000 moms and babies.
And what region does CEDA cover? What geographical area?
Yes, our services, we have 20 locations. We are scattered throughout suburban Cook County and the north side of Chicago. And our caseload is roughly split between the city of Chicago and the suburban area.
So we have 50,000 people.
Moms and babies.
Moms and babies. So that's included, that's everyone, children, parents, 50,000.
Yes.
That's still a large number.
Well, those of us that provide human services, we know what the prevalence of the need is in the community. I think it is shocking for persons outside of that arena to learn that 53% of all babies born in the United States receive WIC services, and so it
That
should
is astonishing to me.
It should be an alarming statistic to show what the income level is of our young families.
Because talk about that, there is an income threshold below
Yes.
which you must reside in that. And what is that level?
Yes. Our income guidelines set at the federal level are 185% of poverty.
Which is still not a lot of money. Right?
It's still not a lot of money. A family of 4 can't make more than $45,000 gross annually.
Which in a city like Chicago doesn't go that far.
Yes, because the data show that those families often experience food insecurity, meaning there is some uncertainty of whether or not there's sufficient resources within the family to consistently provide the
Regular
3 meals a day.
right?
Yes. And so WIC is a voluntary program. It's not a mandated mandated program. So it's really as families feel, yes, I'm having some struggles, some challenges, maybe WIC services can help with that. And I think it's important to point out that even though a pregnant woman is actually a client and can receive food assistance for herself, WIC is a program for anyone who may be a parent or a caretaker of any infant or child under age 5. And one of the emerging...
As long as they fit in these income guidelines.
As long as
right?
they meet the income guidelines.
Right.
And so one of our emerging populations that we want to make sure we're reaching out to are grandparents who find themselves parenting.
Right.
If you have a child under age 5 within your care and you are experiencing food insecurity, we'd love for you to give us a call, and we will walk you through to see whether you meet our eligibility or if there are some other food assistance resources that we can connect you with.
Now, when we talk about food assistance, does that involve actually supplying food to people, or is it really just an educational?
Yeah, that's a great question. That's an important design of the WIC program. What our education and support that we're providing is to put families in the grocery store setting, to actually have conversation about what are the most economical ways to provide a balanced nutritious diet for everyone in the household. And so
without actually supplying the food directly to them?
No, we supply vouchers that the families can then take to the local grocery store. And so that's another very important partner for the WIC program, is that we want to make sure that there are accessible grocery stores within all of our communities where our families live, and that they're providing quality, nutritious foods. The WIC food package is backed by science. We're one of those programs that, there's nothing we do that
scientific
doesn't
facts,
have, yes, there is method behind all of our actions and our steps. And so our food package is very specific. Each food on the WIC food package delivers a particular nutrient that's really, really important for these critical times of growth and development for a pregnant woman and for young brains and growing bodies.
Now that package that you're talking about.
Yes.
You talked about that on a national program, didn't you?
Yes, I did.
Yes.
Yes, I
and
did.
why vegetables are important.
Yes, because in 2009, the United States Department of Agriculture adopted the research and recommendations from the Institutes of Medicine that our families, especially our low-income families, did not have sufficient quantity of fruits and vegetables in their diets. And so we introduced a fruit and vegetable voucher as part of the voucher prescriptive package.
And we just
for
happen to
families.
have a clip of that. So if we can roll that on Sesame Street.
Yes.
What did you say, your 34 seconds of fame?
Oh, yes, yes.
So we'll see if we can roll that.
I said the only time my children have been interested in my career.
Yes. What do you
Apple.
Sweet and red.
Yeah. Oh, broccoli.
Oh, that's me. I'm crunchy and green.
Yeah.
Hi, I'm Margaret Saunders with the National WIC Association. Cookie Monster and I were just talking about anytime foods, like colorful fruits and vegetables.
Yeah.
Help your child explore a rainbow of anytime foods every day.
Oh boy, all this food talk making me hungry. Nom 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 nom.
Learn more at sesameworkshop.org/healthy habits.
Well, that's a pretty entertaining way to get the message
Yeah.
out.
Well, and Sesame Workshop has been a great partner for us on the national level to help roll out some program designs and changes. And another video that they produced for us based on their research of what families and children needed to be more familiar with was visiting food banks and food pantries with grandma. And so they helped develop some videos to help normalize that situation because they realized so many children were in that situation, they needed to see it reflected and spoken to in their own way and then in their own words. And so
I want to come
they've
back
been a fantastic partner with us.
Come back to the statistic you mentioned earlier about 53%
Yes.
of the children born in this country are born into conditions that would warrant this kind of assistance. Is that number growing? Do we have some historical trend that we're looking at?
Oh, unfortunately, that percentage has gone up. We hovered at 50% for nearly a decade, and now it's moving upwards. There are a lot of socioeconomic issues and reasons for that. We have a lot of our clients. As soon as they're entering in their pregnancy and have the children born, there's usually a dip in income.
They can't work as much.
They can't work as much. They can't carry on the shifts. They can't afford the child care. So that perhaps maintaining a dual income for that household has to take a break for a while. And that's one of our concerns is then they start having to make choices of, and perhaps food insecurity issues emerge. And we want to help prevent that so they can get through that employment gap and then return to work without any deficits.
So how hard is it to break habits? So for example, it's really easy to go to a fast food restaurant and it's not very expensive and it's very quick. And especially if you have a family with several young children, you can just stop off and either drive through and pick stuff up or walk in and next thing you know, that problem of feeding my family has been taken care of and it didn't cost a lot of money and it didn't take much time.
Yeah, absolutely. Well, and that's why we have a fantastic team of dietitians and nutritionists that really excel at listening to where families are and what their pressure points are and how they can help give them ideas, give them tips so they can develop healthy habits for a lifetime. Again, one of our goals is to help support families so they feel that they're capable, competent parents and providing for their children.
How do you break that? I mean, because there's so much incentive and there's probably even peer pressure. You know, all my buddies do this. It's easy. The kids love it. How do you help them make that transition? Because it's not easy. It's not just a choice you make. I mean, it's difficult to implement that choice.
Yes, it's baby steps. You start where they are and say, well, what are your goals? What are your goals for your health in your pregnancy? What are your goals for your infant? What are your goals for your child? And we start with that conversation. And then we help lead them to one goal leads to the next goal, leads to the next goal. We really are about building healthy habits for a lifetime.
And so give me a sense of the amount of time it takes. So a young mother comes in, maybe she already has a child or two, is pregnant with the third. How long of a period of time of working with WIC does it take to reorient that thinking?
Wow, that's a great question. Again, we really are wanting to direct our intervention and our relationship and dialogue with the families is to help them move towards their next step for themselves. So it's not our setting expectations for them. It's helping them reach their own personal goals. We find that to be a much more effective approach, leading them to their own goals rather than our setting goals for them.
But this still takes time.
Oh,
right?
absolutely.
You don't just throw a switch and, gee, the
and
light
that's
goes
why
on.
WIC is 0 to 5. We
okay,
want to have a relationship with these families, and so we continue to grow and develop and lead them to develop healthy habits. WIC and some of the results of that we're seeing, the American Academy of Pediatrics just recently, or maybe in the last year, their latest research is showing that WIC is having a positive influence on childhood obesity, in that those families that are enrolled in WIC, they're showing a decline. And so we take that as a very positive step, or that we can be a positive influence in impacting public health outcomes within the youngest
board, really.
citizens
Yeah.
among us. And so we are very proud of seeing those trends.
So just to branch out for a moment, because childhood obesity, as you know, is such a problem in the United States, and actually in many developed and developing countries now, this question of food choices actually does go beyond just those who would be eligible for WIC assistance. Is there anything WIC does or can do or thinks about doing that might help get that message out using statistics like this? Well, statistics are bad, but stories like this that say, look, we've reduced childhood obesity, and here's a way to do that. Anyone can do this.
Here's a way to do that. Well, let me back up and mention all of our efforts in WIC about encouraging initiation, duration, improving duration of breastfeeding, because that is another area that we want to make sure that moms are reaching their goals, their breastfeeding goals, and we're happy to share all the information of how how breastfeeding really impacts the growth and development of the baby, the physical benefits for the mom, and just really promoting a strong mom and baby pair through that first year. And with that prescriptive food package, so one of the things that again, these key nutrients that because we are issuing vouchers that would allow families to buy whole grains, to allow them to buy brown rice, to allow them, encourage them to buy these products. And we are then influencing the grocery stores because they have to then carry these products to be a WIC vendor.
Do the vouchers prohibit the purchase of things like sugary drinks, for example?
That's not an option.
You cannot use the voucher to do that.
For example, breakfast cereal is one of the approved WIC foods, but it needs to be a specific breakfast cereal. And so we have shown that it's an economic advantage for a cereal to be on the approved cereal list. And so we have seen that we influence the market.
That's fabulous.
That is fabulous.
Well, and
we're very proud of that because now those foods are available for the entire population.
Well, it also, one of the, I'm sure you know, in the ongoing political debate about government versus free enterprise, they're set up in the ideological wars that we see as being opposites, polar opposites, and one is the enemy, the other, and that's just not true. I mean, here's a case where they work hand in hand, and the market does in fact respond to creating the demand, which you do.
And that improves the nutritional value of all the foods that are available in all the grocery stores. Another uncomfortable statistic is that every single military commissary is an approved WIC vendor.
They are approved?
Yes, because our military, their income level falls within. So if you have a service person who is a parent or parenting, they're often enrolled in WIC. And so I think it makes people uncomfortable to hear that, but that's the truth, and we need to be aware of that.
I mean, the bad side of that is that the incomes are low enough that they qualify. The good side is that at least many of our military personnel are getting this kind of instruction and assistance, right?
Absolutely.
So their children are getting, I won't say a leg up, but they're getting additional assistance that others in their economic strata might not get.
We consider it a warm touch. WIC is a friendly door to walk through. They're open, welcoming, inviting children. We want it to be a comfortable place where we can have a meaningful dialogue with the families. We weigh and measure the children. We help the families see the growth and development. And we want it to be a positive experience. We won't be able to make any positive outcomes if we don't create a positive environment for that dialogue to take place.
I saw photos on your website of many of the locations that you
Yes.
guys have, and they all seem to be set up with kind of like play areas for the kids. So
Absolutely.
it looks like it's set up to be
We want
comfortable.
to see the children. We want to weigh and measure the children. You know, that's an
You want them to
opportunity
wanna
for us
come
to
there.
say, hey, you're doing a great job. Now, what's your next goal? What's the one thing that's bothering you that you'd like to have a dialogue, that maybe we have some ideas and encouragement that we can help you reach that next goal?
And so how do you reach out? Because there's no mandatory component of this, which, by the way, I like that idea that it's totally voluntary. But how do you reach out to the people who really need it? How do they know, and how do
Sure.
they, and more importantly, how do they, there's always a stigma associated with any kind of assistance. So how do you work to alleviate that problem?
Sure, that's a great question. Well, actually, it's our active participants that are our best advertisers out there. If they've had a positive experience, they're very quick to say to a friend who might be in a similar circumstance, go check out WIC. And they helped me. And in fact, we've been attempting to do a much better job of actually gathering that information of how has WIC helped you. And you know, we're very proud to get feedback from our clients that said they actually helped. They didn't judge. They actually listened to me. And they helped my family through a difficult time. I no longer need WIC, but I would recommend it to anyone who's going through a difficult time. And the reality is there's so much income flux when a baby's born. That we just, it's a safety net. It's a safety net.
Is that kind of the goal, though, is to be able to have people come in and essentially graduate from the program?
Yes.
So
yes,
they've
we're
learned
very
enough
proud of that.
to keep going.
Yes,
Yeah.
and we say thank you, thank you, thank you for staying with us, and we hope that we'll carry on in your journey. Now, if ever a family it's not working for them, or it's not meeting their needs, or they feel more secure in their
The old
with
habits.
their foods, what they have available to them, we wish them well. But it's also, should things change, we're here.
So, and there's never any sense that if they pull out, there's never a closed door. They can always come back,
No,
right?
WIC is a friendly open door, and it really is a self-perceived, I am feeling challenged, and I'm feeling there's some stress that's creating some food insecurity in my household.
So what, first of all, how long has WIC been in place?
Yes, the original program began in 1972.
Okay. So there should be a history of outcomes, right? And what, how are those outcomes measured? How do we know that the children who've been through this program, if they do better in school, do that? How much better? How do we know that? Do they go on to jobs and careers? Do they stay out of jail more likely? I mean, do we know any of this? Is this
wow?
studied?
That would be great if the data were that longitudinal and comprehensive. What we do know is that for every dollar spent in the WIC program saves $3 in medical assistance later on.
How do we know that?
Yeah, because most of our families were often also enrolled in public assisted medical services, and so they would begin doing the data. We have healthier, fewer low weight births, which is an important factor in how well an infant's going to thrive. We want to try to avoid low birth weights. We do know that through WIC we had a breastfeeding initiation rate in 1998, I think, was the first data point that we really were looking at breastfeeding initiation rates, and they were around 48%. And in over 10 years, we've been able to increase that up to about 70%.
Meaning 70% of the women who go through the program breastfeed their children.
Choose to breastfeed. And we believe that's because of the support and encouragement that they're getting through their relationship with WIC.
And you mentioned earlier about the duration of breastfeeding. What is the proper duration?
The proper duration is forever, as long as the mother and baby feel it's appropriate for them.
So a child the age of 5, for example, might still be breastfeeding?
WIC is a place that doesn't judge. We accept and say, what is your goal? The American Academy of Pediatrics encourages at least until age 1. We're nowhere near that. And
It's
so
usually much shorter.
it is usually much shorter, and especially for our clients, because there is a tremendous amount of pressure as I need to go back to work. I need to return to school. I'm in a workplace that doesn't support breastfeeding. And then, so we listen to that and say, so
Right.
what is your goal? How can we help you with that?
But the minimum objective would be a year. Is that safe
We would
to
love
say?
that. That is part of the Surgeon General's healthy
Healthy living, healthy.
yeah, healthy
growing?
outcomes,
Yeah.
you know,
Yeah.
for a healthier nation, and but we're nowhere near that.
Do we know where the general population is on that? I mean, yeah, not even thinking about low income, but
Again, we're nowhere near that.
yeah, I'm not surprised by that.
We're nowhere near that.
Yeah.
Formula companies are a powerful force.
They are. My mother, who grew up in, of course, a much different generation, was part of the first generation of women who were told by their pediatricians that, oh no, this formula is much better for your children. And even my mother at the time, who, you know, and she was of a generation where doctors knew and you just listened to the doctors. And even at the time, she thought, this seems like a bad idea. I mean,
Yeah.
for untold millennia, women have been feeding their children through breastfeeding.
Right.
How has evolution missed the mark so badly that modern
Sure.
pharmaceuticals can make up the difference? And she never really bought that, which I great credit to her, particularly at her time.
Well, and certainly our perspective is it's really the mom's choice. And what are her goals, and how can we help her reach her goals? WIC does provide vouchers for infant formula for those moms that have chosen,
Or may have to,
and
right?
and it is a sustainable product. But we also want to help support the mom that says, I really want to achieve this. I think it's going to be important for me. And we say, well, we're here to help you.
I just read an article about physical contact with newborns and how important it is for the newborn child to lie skin to skin next to the mother immediately after birth, apparently, and then again throughout infancy, that physical contact has an enormous effect on development. So I would think one of the additional advantages of breastfeeding is that level of physical contact that you just don't get with formula. Is that safe to say?
Absolutely. And that is an important part of our education and dialogue with the pregnant moms, that we say, this is important. Have these conversations with your physician. Have this expectation as you go into the hospital. How to be an advocate for yourself, so you're making sure that you're getting this experience, that your infant is getting this experience. Here are some ways to make sure that happens, and we're here to support you. If you're having any problems in the first 24 hours after the baby's born, you can always call us. We'll be here. We'll help you through that.
Speaking of support, 30 seconds left. How can people who are watching this show support you?
How can they support us? To help get the message out that we're here, we're in the community, we're open, we're accessible, we're a friendly door. Anyone who may be parenting, whether moms, dads, grandparents, if you have anyone under the age of 5 in your household and you have some concerns about food insecurity, WIC is there for you.
The door is open.
The door is open.
Great way to sum up. Thank you, Margaret.
All right, thank you.
And thank you for joining us once again on Public Perspective. I'm your host, Kevin McDermott, and we've been visiting with Margaret Saunders. We thank her for her time. We thank you for watching us once again on Public Perspective. You can see us every Saturday night at 8 on Comcast Channel 19 and find us on the web at publicperspective.tv. Till next time, thank you and good night.